Let us see the histology of large artery, medium-sized artery, large vein and medium-sized vein. First, let us see the large artery. Large artery is also called as elastic artery. It consists of three layers: tunica intima, tunica media and tunica adventitia. Tunica intima is the innermost layer, tunica adventitia is the outermost layer covering the blood vessel, and tunica intima covers the lumen. Tunica intima consists of endothelium, subendothelial connective tissue and internal elastic lamina. Tunica media consists of smooth muscles and elastic muscle fibers. Tunica adventitia consists of vasa vasorum in large arteries, and the external elastic lamina is also related to tunica media. Now let us see the identification points of each layer. Three layers of blood vessel: tunica intima, tunica media and tunica adventitia or externa. Tunica media is thickest with more elastic fibers in large arteries. Tunica intima is the innermost layer. It consists of flat squamous cells line the lumen, and subendothelial connective tissue and internal elastic lamina. Internal elastic lamina made of elastic fibers in the form of fenestrated membrane, but internal elastic lamina is not prominent in large arteries. Tunica media. Tunica media is present in between internal elastic and external elastic lamina, and it consists of elastic fibers. External elastic lamina is also related to tunica media, and elastic fibers are prominent in the form of concentric fenestrated lamellae. Hence, internal elastic lamellae is not prominent. It helps in the recoil of the artery after distension. Outer elastic lamina is present. And tunica adventitia. It is the outermost connective tissue layer with prominent collagen fibers and also contain vasa vasorum. Vasa vasorum are nothing but the blood vessels that supply the walls of large blood vessels. These are nothing but the vessels in the vessels. Examples include aorta, brachiocephalic trunk, common carotid, subclavian and common iliac arteries. Now let us see how to draw the large artery or elastic artery. First we need to draw the flattened cells which covers the endothelium, which is known as endothelium, and then we need to draw subendothelial connective tissue, and then we need to draw internal elastic lamina, and in tunica media we need to draw so many elastic fibers and very few smooth muscle fibers, and we need to draw external elastic lamina. This completes tunica media, and in tunica adventitia we need to draw connective tissue and the vasa vasorum in between. This is the large artery or elastic artery. These are the identification points. This is how we see in a microscope. This is the tunica adventitia external layer, tunica media and the internal layer. So these are the identification points. Now let us see the medium-sized artery. Medium-sized artery is also called muscular artery. It also consists of three layers: tunica intima, tunica media and tunica adventitia or externa. Here the tunica intima consists of endothelium, subendothelial connective tissue and internal elastic lamina. Tunica media consists of this middle muscular layer and external elastic lamina, and tunica adventitia consists of connective tissue. Tunica intima. Now let us see the identification points of each of these layers. So tunica intima is the innermost layer. It consists of endothelium. Endothelium is made up of flat squamous cells that lines the lumen, and subendothelial connective tissue and internal elastic lamina. Here internal elastic lamina is made up of elastic fibers in the form of fenestrated membrane. It is wavy and it is prominent. Tunica media is the thickest. It consists of more smooth muscles and less elastic fibers. And the contraction of smooth muscles reduces the luminal diameter. They also give rise to the elastic and collagen fibers, help in repair of damaged endothelial cells. Outer external elastic lamina is present. Tunica adventitia is the outermost layer, contains connective tissue with collagen and elastic fibers. Examples include radial, ulnar, and popliteal arteries. Now let us see how to draw the medium-sized artery. First, it consists of tunica intima with endothelium, which consists of flat squamous cells, and the subendothelial connective tissue and internal elastic lamina. And this is the tunica media, which consists of more smooth muscles and this very less elastic fibers, which look like wavy appearance. And this is external elastic lamina. And this is tunica adventitia with connective tissue with few elastic and collagen fibers. Previously in medium-sized artery we have vasa vasorum, but there is no vasa vasorum here. Now let us see the differences between large artery and medium-sized artery. Large artery. Here the tunica media is thickest with more elastic fibers, whereas in medium-sized artery, tunica media is thickest with more smooth muscle fibers. See, this is large artery, this is tunica media. Here we can see there are more elastic fibers and very few smooth muscle fibers. This is medium-sized artery where there are more smooth muscle fibers and very few elastic fibers. And in large artery we can see that internal elastic lamina is not prominent, whereas in medium-sized artery it is prominent. Here in large artery, examples include aorta, brachiocephalic trunk, common carotid, subclavian, and common iliac arteries. In medium-sized artery, examples include radial, ulnar, and popliteal arteries. In large artery, we have seen that vasa vasorum are found in tunica adventitia or tunica externa. See here, this is the tunica adventitia of large artery, and we can see this vasa vasorum present in tunica adventitia. Now these are the identification points of medium-sized artery. Now let us see the histology of large vein. It also consists of three layers like tunica intima, tunica media, and tunica adventitia. The difference between arteries and veins include that tunica in arteries, the tunica media is more, whereas in the veins, tunica adventitia is more. Now the large vein also consists of these three layers. Tunica intima is made up of endothelium and subendothelial connective tissue, and tunica media and tunica intima. Now the tunica intima is the innermost layer and it contains endothelium, which consists of flat squamous cells that line the epithelium, that line the lumen, and subendothelial connective tissue, and internal elastic lamina. Subendothelial connective tissue and internal elastic lamina are not well defined. Tunica media, it consists of few smooth muscle fibers, elastic fibers, and large amount of collagen fibers. Tunica adventitia is the outermost thickest layer. It consists of connective tissue with collagen fibers and contains longitudinally running smooth muscle fibers. Examples include inferior vena cava, superior vena cava. Now let us see how to draw this large vein. It consists of tunica intima, endothelium, subendothelial connective tissue, and this is tunica media with smooth muscle fibers. And this is the tunica adventitia with longitudinally arranged smooth muscle fibers and some vessels between them. So these are the identification points of large vein. Three layers: intima, media, tunica adventitia. Tunica intima, innermost layer, endothelium and subendothelial connective tissue. Tunica media, large amounts of collagen fiber, few smooth and elastic fibers. Adventitia, connective tissue with collagen fibers, longitudinally arranged to smooth muscle fibers. Now let us see the histology of medium-sized vein. This is the medium-sized vein. It also consists of tunica intima, media, and adventitia. Tunica intima it consists of endothelium, which consists of flat squamous cells with basal lamina. This is the basal lamina. This lines the lumen. Thin subendothelial connective tissue seen, and internal elastic lamina not well defined. There both subendothelial connective tissue and internal elastic lamina are not well defined. Here we cannot see the internal elastic lamina. Tunica media. It contains both circular and longitudinal smooth muscle fibers, collagen fibers and elastic fibers. And tunica adventitia is the outermost layer and thickest layer and consists of connective tissue with collagen and elastic fibers. Examples include cephalic vein and basilic vein. These are the identification points of medium-sized vein. So let's revise this. So the difference between arteries and veins include arteries tunica media is thicker, whereas veins tunica adventitia or externa is thickest. And the large artery, it consists of 3 layers: intima, media and adventitia. Intima consists of endothelium, subendothelial connective tissue, internal elastic lamina. Tunica media consists of muscle layer and external elastic lamina. Adventitia consists of connective tissue and vasa vasorum in large artery. Medium-sized artery, same layers, but there more elastic fibers we can see in large artery. Here more smooth muscle fibers we can see and no vasa vasorum. And let us see large vein. Large vein we can see the intima, media and adventitia, endothelial, subendothelial connective tissue and smooth muscle fibers in media and adventitia we can see longitudinally arranged smooth muscle fibers. And this is medium sized vein. So thank you.